such during pregnancy that you lost all the strength, you became so dehydrated? Or have you ever felt so nauseous that you could not eat anything for so long in your pregnancy? Or have you ever been around a pregnant woman that she vomited so much, like beyond the normal, usual morning sickness that we all know that I won't exceeded, like went so long? Hello everyone, you're welcome to another episode of 𝗦𝗳𝗺𝗺 channel. I'm Rachel, a registered nurse and midwife. On today's episode, I have my friend here who will be doing the video with me today. Can you kindly introduce yourself?
Hello everyone, my name is 𝗃𝗍𝗺𝗪𝗺. I'm a registered nurse and a registered midwife.
You're welcome, Tolu.
Thank you.
Alright, so today, Tolu and I will be talking about �hyperemesis gravidarum. So the scenario I just described at the beginning of this video is what is called �hyperemesis gravidarum. So Tolu, can you just quickly tell us what �hyperemesis gravidarum is?
Okay, �hyperemesis gravidarum is excessive vomiting in pregnancy, which occurs during the first trimester and also lasts longer. And it is different from the usual morning sickness and nausea and vomiting, which occurs, and that is due to a hormone in the body. But �hyperemesis gravidarum is caused by other causes.
Too.
Yes, other factors.
All right, thank you. Yeah, so that is what �hyperemesis gravidarum is. It's excessive vomiting, more than the usual morning sickness that we all know. Yeah, so now let's move to the causes of �hyperemesis gravidarum, because some of us could be wondering that, okay, what causes �hyperemesis gravidarum? Why is it that some women just have this normal nausea and vomiting, it doesn't last so long, just early in the pregnancy, and after some time it subsides? While some other women don't even have this symptom, like some women don't even know they are pregnant until months, like they don't even vomit, they don't feel nauseous, they eat normally and all of that. So what causes �hyperemesis gravidarum? Because this �hyperemesis gravidarum we're talking about, we said is excessive, and since it's excessive, it has become a medical condition that sometimes it requires medical attention. Like the woman actually has to go to the hospital to be treated for this condition. So what are the causes of �hyperemesis gravidarum?
Yeah, so studies have shown that �hyperemesis gravidarum is majorly influenced by psychological state of the mind and also socially. So it's common among women that seek attention from their partner, from their relatives, and also it's common among educated women that are nervous.
Oh, this thing I just mentioned reminds me of a scenario. I remember one time when I was in the hospital and we had an admission. A woman was admitted, and our relatives brought her that she has been vomiting so much, so excessively, like she was already so weak out of vomiting so much, and she was vomiting very frequently. She could not eat anything, she could not retain anything, and anything that she eats, else she would throw it out. So they brought her to the hospital, and after they brought her, we had not even done any treatment for her, like for some time. And do you know that since the time they brought her till like hours after, she had no single episode of vomit. And then we're all wondering, like, okay, what happened? Because the way our relatives were describing it, like she was always vomiting so frequently, like in how many hours she would have vomited so many times. So it just showed that she had changed her environment. She was in a new environment, like different people around her and all of that. So I just wanted to emphasize on the point that yes, many times �hyperemesis gravidarum is like a social issue. Sometimes some women, when the people that are around them during their pregnancy, they could be a change. Some people want to be around maybe their family members, want to be around some particular people. So some psychological issues like that, some social issues could actually influence �hyperemesis gravidarum. Also, from what you said, that maybe women that are seeking attention from their husband. I'm not saying that everybody that has it is seeking attention,
Yes,
but
yes.
from what we have seen, because I'm just imagining that, look at some ladies that maybe they have like unwanted pregnancies, they get pregnant out of their will and all of that. Like they are strong, they rock, they go through the pregnancy like without any itch, like people that are not even getting attention, that rather people are even telling them that how can you get maybe a young girl that just gets pregnant, that people are even talking to her that how did you get pregnant like that, and
depending on anyone.
Exactly. You see, and also you also mentioned socioeconomic status, people of higher, maybe educated women and all of that. You see, people that are not so, like they are of low socioeconomic status and all, like during their pregnancy, they still have to work, they have to cook for their husbands, they still have to fend for their families. Those women, my dear, they're actually strong. They don't, you don't really see them with all these kind of conditions and all. So I think, like personally, like with what I've seen, I think I'll actually like go with what those studies have said. Yes. So all right. So another cause of �hyperemesis gravidarum.
Okay, another cause is being overweight,
Okay.
obesity,
Okay.
and also first-time mothers there is a
Okay.
whole new experience for them,
Okay.
and
And maybe they're
they
more
are nervous.
anxious.
Yes,
Yes. The
yes,
anxiety and
the
all. Yes.
anxiety.
Yes.
Yes,
Okay.
that's another cause. And also, when there is a growth in the uterus,
Okay, like
abnormal
abnormal
growth,
growth. Yes.
abnormal growth
Yes.
in the
Yes.
uterus is
Yes. And
also
also maybe
part
people
of
with
it.
multiple pregnancies. They're usually more
Yes,
common. Maybe
twin
a woman.
pregnancy,
Yes.
yes,
Yes.
triplets,
Triplets
and so
and
on.
yeah, and
Yes.
the like. All right. So we're able to discuss the causes of hyperemesis gravidarum. Okay. So now at this point, what are the signs and symptoms? Because we already established that nausea and vomiting, which is morning sickness, which we are most familiar with, is normal in pregnancy. Yes, and many women experience, do not all, but very many women experience it. So, at what point do we say that okay, this is hyperemesis gravidarum, like it has already gone beyond the usual morning sickness, the usual nausea and vomiting? So, what are the signs and symptoms that a woman would exhibit that will know that okay, this is hyperemesis gravidarum?
Yes, one of the signs is when the vomiting gets is more than 4 times a day.
Okay, so
Yes,
when a woman is vomiting like
yes,
more
more
than
than four
very
times
often,
a day,
okay.
and it leads to dehydration and feeling of lightheadedness, and also there will be visible weight loss in the person.
Okay, yes, when a person has been vomiting and then obviously this person has lost weight, like a
Yes,
person
yes.
loses weight so significantly in pregnancy, okay, yes, it could also be an indicator of hyperemesis gravidarum. All right, thank you very much. So now we know the causes of hyperemesis gravidarum, we know the signs and symptoms that can, okay, say, okay, this one has gone beyond the usual morning sickness, the usual, and I think also it lasts longer. That's another thing again. That the
Yes.
normal not morning
Morning
sickness. This one
sickness.
can even go beyond the first trimester. Imagine, we said that this morning sickness usually lasts like early pregnancy, first trimester, but a woman that still keeps vomiting after first trimester, keeps and all of that. Yes, and also if this kind of person goes to the hospital and runs a test, there will be significant electrolyte imbalance because from the vomit she's losing electrolytes
Yes,
and fluids
losing
from her body
electrolytes.
and very dehydrated. All right, so let's talk about the management. So how can this thing be managed? Yes, because especially for our viewers, like how can it be managed at home even before? But when
Coming
it
to
gets so
the hospital.
excessive, yes, it will be a medical condition that the person might even require admission. They might have to put the person on drugs, on IV fluid to
Yeah.
rehydrate, and all the person's already very dehydrated and weak and all of that. Yes. So, but what management at home can people
Now
do
people
like
do.
years before it gets to the stage of going to the hospital?
So some of the things we can do is eating foods that are rich in vitamin B6, such
Okay.
as ginger,
Okay.
bananas, vegetables. So, and also eating dry foods
Okay, that will not make
to
someone feel
yes, to not make
nauseous,
us
like
feel
dry
nauseous.
crackers and the likes.
Dry
Yes.
toast, and also dry toast, and
Okay.
also eating in smaller portions. Eating smaller frequent meals. You can eat smaller portions of food, not just eating the whole meal that is stretched like that.
Okay.
So
Small
yeah,
frequent
small
meals.
frequent
Okay.
meals.
Yes.
And
Okay.
also there's something called acupressure, which can also relieve the nausea and vomiting at home, which you can do, and we'll be
Okay.
practicing that
Okay.
together. Yes,
Okay.
we'll be
Okay.
doing
So
that
can you show
together.
us acupressure?
Okay, so acupressure can be done by when you place these 3 fingers
Okay. These
around
three.
your yes, these three
Okay.
fingers around your wrist. Yeah.
Okay.
So then your index,
I don't know if they can see
yes,
it.
yeah,
Okay.
so just follow the way I'm saying it. So your index finger, the last finger here. So you replace your index finger with your thumb. This one.
So these three index finger are here like this.
Yes.
Then you replace this index finger, this one,
With
with
your
your thumb.
thumb.
Okay.
So there's a depression you will feel.
Yes.
You can
Yes.
also make a fist so that you can feel
Okay, another way to feel that depression
yes,
is to make a fist. Then
yes,
okay,
you can feel
mine is
the
very obvious.
yes.
Okay, yes, this is the
Then
depression.
there's a fist there. There's a depression there. After
Okay.
making the fist, so depression, you rub the depression, that part, you rub it in a
Okay, in a
circular
circular motion.
motion.
Just apply pressure in a
Yes, just
circular
apply.
on that depression. The major thing is to first find that depression. So you can either do it by placing three fingers, then replacing your thumb with
Yes.
okay, then
So
find,
apply.
or you do it the other way of just making a fist, then that depression you notice,
So
then
apply pressure and
in a
rub
circular
it in a
motion.
circular motion. Yes,
Okay,
it's
so it
also
will
to
relieve
relieve the nausea and
nausea.
vomiting.
Yes. Okay. And this acupressure, actually, the way it works is that from research and these findings, it shows that wrist pressure actually harmonizes the stomach and relieves
Yes,
nausea. Yes, and relieves nausea. All right, thank you so much, Tolu, for that. So we've learned something new. So when you're feeling nausea, all right, I've come to the end of this video. I'm sure you have learned about 𝗲𝗺𝗺𝗃 𝗵𝗵𝗺𝗺, the causes, the signs and symptoms, and how to manage it, especially at home. So thank you for watching. Kindly comment if you can relate with what we've said, if you ever experienced it, or you know someone that has experienced it, or you've tried any of these things. So we'd like to see your comments, and if you have questions, you can leave your questions for us in the comment section. And thank you. Kindly like this video, comment, share, and subscribe. Bye.
Bye.